But it is amazing how often throughout the day I'm talking about breathing, posture and movement. That's all I talk about. For me, posture and movement, what can really affect that is muscular imbalances and tightness. And if we're thinking about breathing and inspiration, expiration, it's amazing how many muscles are just involved in that.
Welcome to the OptiBreathe Show, where we explore the world of breathing. I'm your host, Princess, and today we'll discuss the relationship between breathing, posture, and movement, how breathing exercises can help relieve lower back pain, and how to apply specific breathing patterns for weightlifting, golfing, and clinical Pilates. Joining us today is James McDermott, a physiotherapist and clinic owner of Seven Summits Rehab and Health. Seven Summits Rehab and Health is a holistic clinic utilizing specialist therapists who not only address one's physical rehabilitation, but also one's overall health and well-being goals through their Sevens model. More about that later, as I would like to thank James for hosting us in this beautiful Kitsilano location. Thank you for being a part of this show. I'm happy to have you here, and I'm excited to share your insights with our listeners. Let's start off by having you tell us a little bit about yourself and what inspired you to be a physiotherapist.
Okay, well, yeah, my name's James. Originally from London, UK. Moved to Vancouver around 4 years ago now. Came here to kind of climb, snowboard, and potentially own my own clinic, which has happened, which is great. What inspired me to become a physio? Always been into sports as a kid, playing a lot of football and soccer and golf. And I suppose didn't really want to go down the academic route that you need to become a physio. So decided to go off traveling, cooking, which is a passion of mine, and then realized I had to go back into academics. So I went to university, qualified as a physiotherapist. And in the UK, we do our rotations. So we do kind of respiratory neurology and musculoskeletal, so MSK pain. So kind of gave me a good grounding and skill in that sense. And then decided to kind of pursue my passions more, which is sports injuries. So went down the more kind of private practice clinics, treating sports injuries, and then pushed on from there really. I think a lot of physiotherapists get to a point where they're a little bit unsure what's happening in their career. They're unsure what's working and what's helping patients. Where for me, I pushed on for more kind of courses and went down more of the route with Pilates, strength and conditioning, acupuncture, and more kind of high level manipulative spinal therapy. And that kind of gave me that passion as I kind of realized what works with patients and what helps them. And actually what we actually do, does benefit the patient. So that kind of gave me that passion to then push on, own my own clinic and start treating more of the kind of sports injuries and high level athletes as well.
Yeah, that's a lot. Like that's great, and I feel that integration of all those practices when I come here and get treated by you. Um, And not only are you a physiotherapist, but you're also the clinic owner of Seven Summits Rehab and Health. Why Seven Summits? Like, what's the Sevens model?
Yeah, in a way, perhaps I should have chosen something simpler. Kitsilano Physio would have been simple, but for us, Seven Summits. Firstly, the Sevens model. Probably my 15 years experience as a physio, I've kind of brought in 7 areas of treatment that I think the patient needs to kind of address most of the physical dysfunctions that we see, but also takes into account their well-being, health and mental well-being. So it's not just about the physical dysfunction. I was kind of fed up of working in clinics where we would see a patient for 20 minutes and they'd be coming in with pain and anxiety. We would treat the symptom, they'd leave maybe slightly better, maybe sometimes worse, and that would be it. And it wouldn't take into any account their feelings or their emotions or their stress levels. So we kind of wanted to bring in a clinic that brought in the physical dysfunction, but also, as I said, their well-being and how they're feeling, their anxiety levels. And that kind of takes us on to the kind of second part of the sevens, where we kind of provide the patient a sensorial experience in the clinic. So we try and calm their heightened sensitivity from an injury with the clinic vibe, and try and target the seven senses of the body. So we do that through our minimalist Japanese kind of influence in the clinic, the warm kind of natural woods, the warm lighting, the health promoting plants we have. Yeah, the plants. We created our own healthy waters and our essential oils that are diffused through the clinic to just try and calm the situation. It's not just about that physical pain.
More
It's
about the
about
sensory kind of aspect.
yeah, and that has a massive effect on symptoms. If they're so heightened and so stressed about pain or goals or the next activity that they can't do because they're in pain, then we try and kind of dive into that kind of area a little bit more, and we think we do that. So that's part of the sevens model. And then summits for me, summits is kind of a goal personally. My goal is to climb the seven summits of the world. So it's the seven highest mountains in each continent. It's not going to happen, but it's a goal. And I suppose for patients, whether it's higher level sport or just mobilize into the shops, it's still a goal, it's still a summit to reach for them. And that's why we brought that in to give the name Seven Summits Rehab and Health.
And I know that, part of the sevens model that you don't specifically talk about breathing, but I can, see in the practice that I have with you, the treatments that I have with you, that you do utilize breathing and you do integrate breathing with, your assessments and your treatments and everything like that. And in order for us to move, we need to breathe. And in order for us to breathe, we need to move. So what is the relationship between breathing, posture, and movement?
Yeah, as you say, it's not a service we offer as such here, but it is amazing how often throughout the day I'm talking about breathing, posture, and movement. That's all I talk about. And without going into too much detail about mechanics as such, but for me, posture and movement, what can really affect that is muscular imbalances and tightness. And if we're thinking about breathing and inspiration, expiration, it's amazing how many muscles are just involved in that. So just a little bit of anatomy. So inspiration, you need your diaphragm, your external intercostals to help with that inspiration. Expiration is passive, but forced expiration, you're looking at the internal intercostals, the abdominals and the costals. And then we have the accessory muscles that are used with exercise or in disease or respiratory dysfunction. And again, there's such an array of those muscles. We've got kind of sternocleidomastoids, scalenes, pecs, traps, lats, QLs. So it's quite amazing how many muscles are involved in breathing. So if you get imbalances or tightness or weakness in those areas, it's going to have a huge effect on breathing mechanics. And just kind of like for an example, I suppose a common one would be where that's maybe my posture now, but if you get a rounded spine or a thoracic kind of kyphosis, it's going to have an effect on areas like those muscles, like those accessory muscles that we're talking about. So you'd get tight pecs, the SCM muscles would get quite tight, the neck's going to stick out a little bit more, and we're going to be restricted, and we're not going to be able to expand. So I suppose when you've got all that tightness and it starts to affect those mechanics, it's just a knock-on effect from the thoracic spine to the neck to the breathing mechanics. So posture, movement just has a huge effect on breathing mechanics.
Sounds good. Yeah, I agree. And that's why we're here today, to educate our listeners and our viewers, because I don't think that we consider breathing to be a part of our, daily assessments or daily treatment. It is something that we kind of overlook. Can you explain the role of breathing into your workflow, and how do you integrate it into your assessments, into your treatment and into your like exercise programs?
I think from the assessment point of view, as soon as a patient walks in, I'm looking at certain things already with regards to breathing. So I'm looking at their inspiration, whether they're using their accessory muscles that we've talked about, whether they're breathing from their traps or their sternocleidomastoids. So already I'm looking at kind of those types of
Is this something like you ask them to like actually take a breath in, or are you kind of just sitting and observing and
Yeah,
they're
sitting and observing for sure. It's probably when the patient's at their most natural. But then you're right, I do then ask them for a diaphragmatic breath or an abdominal breath, if you like. And maybe they have no awareness of that and have not been taught that before. Or maybe they have, and I'll look to see what they're doing with regards to that. Whether they're flaring through the ribs or whether they're loading their back really hard, which I normally see. So straight on the assessment of just observing, we can get quite a lot of details with regards to their mechanics.
okay.
Palpation as well is quite an important thing. So feeling for rib restrictions or pain, feeling for different kind of levels of expansion. So we might get a higher right side expansion through the chest, indicating possibly weakness or tightness or imbalances. So they're the types of things I'm looking at. And even if they're coming in with shoulder pain, this is still an important area to look because it does affect mechanics further around the body. From a treatment point of view, I suppose when I'm treating a patient, they're normally quite guarded and tight. So I'm just talking about relaxed diaphragmatic breathing with them during the session without even talking about exercise, just to kind of calm them down while they're having treatment, to calm the tension of the muscles. So in that sense, during my workflow, that's what I'm talking about during my treatment session. So if we're talking about the stability part of the exercise program, I'm thinking of centering the spine more so with them to begin with, to try and improve respiratory function. So I'll be looking at their rib angles. I'll be centering their pelvis, so a neutral pelvis, trying to expand inspiration from the lower lungs to get away from loading that back. And it just centers them and gets them more aware of where their kind of pelvis should be positioned and their breath inspiration work. The exercise from that, I'm normally going down the inspiration route. So we inspire and then breathe out during the move, helps them center and get like a little bit more aware of what should be activated. Pilates, if we're doing more of a Pilates session and exercise session, then straight away we can kind of see them using their accessory muscles. If we get them on the Pilates reformer, for example, they tend to kind of tighten up and just become completely unaware of the muscles that they should be working. So in that sense, we kind of breathing is just discussed right from the start, which we kind of take it a step back and focus on kind of simpler exercises. Again, focusing on centering the spine, centering the pelvis, working on diaphragmatic breathing to try and control and release the tension from the accessory muscles.
Okay.
So that's more of the focus with regards to breathing in that kind of setting.
Yeah. And we're talking about a lot of like the lower areas when breathing. And so my next question would be about lower back pain. And I remembered you mentioning to me that during lower back pain assessments, you do look at the patient's breathing. Why is this? Can you kind of go into the details of what's happening there?
Well, the diaphragm's connected to the ribs and the thoracic vertebrae. And if there's a dysfunction in the diaphragm, then there's thoughts about the slings that are connected to the diaphragm becoming dominant. And those are kind of the quadratus lumborum muscles and the psoas major. And every physio kind of knows that's a lot of our caseload throughout the day. A lot of tone, a lot of tightness around those two muscles. So it would be kind of wrong for us to then not assess breathing mechanics if we're seeing such tightness and dominance in those muscles.
Like if someone's not really using the diaphragm, let's say, sure, it gets tight, but what if they're really, like kind of breathing it like this? Like when I kind of show that as an example, my back actually kind of arcs a little bit. And so can that contribute to lower back pain because of breathing through the chest as opposed to down below into the diaphragm?
Definitely. Lower back patients tend to have kind of reduced awareness around that back, reduced kind of proprioception, things like that. So they tend to hinge a lot into their back. They tend to use those paraspinals a lot. So it's an important area to look at. A lot of the patients kind of that have maybe been told how to breathe in the past, or they've Googled a breathing technique to help with their lower back pain. And then having a look at them in the clinic, it's normally kind of what I see like a deep inspiratory breath, like a suck in through the stomach, is what we see a lot.
Yeah.
And that's fine, but in a way that kind of has a negative effect because it does change the pressures in the abdomen to a negative pressure. Where if we're talking about stability through the spine, we're trying to increase that intra-abdominal pressure. So for us, that's a deep inspiratory hold and not a suck in through the stomach as such.
Pushing out more, like
Yeah.
360.
Yeah, and that will give you that pressure and that will give you your stability as such.
With that being said, I've seen a lot of studies that talk about how breathing exercises can be an adjunct to chronic, non-specific back pain, lower back pain. How do you integrate breathing exercises into your approach to treatment?
I keep it simple initially. It's normally a new concept for a lot of the patients I see. So if you're trying to teach a technical exercise and then you're talking about breathing as well, it's kind of pointless because it's just going to be really difficult for the patient. The technique's going to be off with both the exercise and the breathing pattern. So I take it a step back. I go to my Pilates, like low level 1, level 2 Pilates, and that's where my focus is. So I focus on neutral pelvis, rib angles, discussing about transabs, and there's evidence out there saying that transabs are activated more with the correct breathing pattern. So that's the area I focus on. An inspiration or a diaphragmatic breath to begin with, load those lower lungs, expand those lower lungs, and then an expire during the exercise. And that allows us to keep centered, brings the patient more aware of their inner core, and the aim is to then contract the transabs to provide that stability.
And the tens abdominis area, is that during exhalation where it's activated, or is it both inhalation and exhalation?
I think you're trying to be aware of it throughout the move.
Okay.
I think an inspiration or relaxed breathing initially, you should be able to get those fingers in that zone and start feeling where those transabs are contracting.
Okay.
And then an expiration, we don't want to lose control of those muscles and we don't want to just push them out, which is what we see a lot. But we want to be drawing that towards the spine, not sucking in towards the spine, but a nice gentle draw down, providing that centered, stable position of the pelvis.
Can you demonstrate a simple at-home mobility exercise that's combined with a breathing exercise to help alleviate lower back pain?
So I like this one because it targets the whole posterior oblique sling of that back trunk. So have a lie down, preferably a weight or a barbell above the head.
Okay.
And we can have a single arm under it. So the hand goes under that weight in that sense.
And is my feet flat on the floor?
Yeah,
or-
we'll go feet bent to like 90 degrees. So bend those knees. Some of you might say, why are we doing it on this floor? It's not very functional, but it allows us to kind of get that pelvis neutral and allows us to think about ribs because you can expand those lower lungs now and you can feel the feedback from the floor. So expanding those lower lungs, so breathing in from down here, and as you breathe out, you're going to rotate these legs to the right. So what else this does is works on overhead mobility because that sling comes up right through the trunk into the lats. And when you're restricted in overhead mobility, again, that's affecting breathing mechanics. So bring those legs back in. And again, so relax that arm, neutral pelvis, rib angles, breathing in to prepare, breathing out, rotation, stretching out this whole sling on the back chain. and back in. How does it feel?
It feels good. Very good. Yeah, and you definitely have to really concentrate on the rib and hip alignment there, because if I'm like this,
Yeah.
then the ribs are flaring out.
And now you're going to load that thoracolumbar junction with a rotation. So it's definitely counterproductive. So a simple correction, it's going
Tucking
to
in.
a little bit of a tuck.
With all this talk about lower back pain, I've read that it is one of the top complaint amongst golfers. Do you think that the way that they breathe during the swinging of the club has an impact on that lower back pain?
Definitely something to consider. I think a lot of the amateur golfers out there, the last thing on their mind is what's happening with their breathing. They've got 20 different technical things they're thinking about the swing.
Yes.
So it's a difficult area, but if we look at the mechanics again, it definitely could have an effect. You know, most golfers hold their breath from what I've seen because they're tense, and most, as I said, just have no idea what they're doing with the breath work. And if you hold your breath, you could argue it's going to limit certain kind of movements and flexibility. So we would rather them inhale during kind of a backswing to kind of give them some mobility, and then exhale on the way down on that kind of downswing, creating power, and releasing that tension. So yes, I do think the
And having that
majority.
like follow through with the
Yeah,
exhale, because I can't really imagine if you're inhaling or if you're holding your breath and you swing, you're kind of stiff around that area. So really, how can you follow through?
exactly. And what are you going to bring on? You're going to be bringing on those accessory muscles because you haven't got that kind of strength there. You're going to be bringing on the traps, and you're going to try and hit the ball with those muscles, and you're going to become upper body dominant, which we don't want in golf. So yeah, it can definitely put some pressure, added pressure onto the back.
Is there a more efficient way to breathe for a golfer's performance?
Yeah, I think so. I think initially, just because of the amount of tension that most golfers have over the ball on the tee, just simple diaphragmatic breathing initially for like 3 breaths is enough to kind of help release that tension through the body, provides oxygen to the muscles, getting ready for that recoil. So 3 breaths initially, leading on to that deep inspiratory breath to help with that flexibility to get round there on the backswing. And then all that power and all that release comes from the exhale. Mm-hmm. So yeah, I do think that's going to optimize their performance. I also think that it helps with a routine. A routine is so important in the golf swing. And most golfers, as I said, have like 12 different things to think about with regards to their backswing, where if you have a little bit more of a thought on the breathing aspect, and that would be your routine, come up to the ball, 3 breaths, let it become a little bit more fluid instead of having all these other areas to think about, you might start to see a little bit more relaxation and a natural swing. So I think it can improve performance with a bit more focus on breathing technique.
All that talk about spinal tension. So, how is the spine involved in the process of breathing?
Well, firstly, we've got the thoracic spine and the thoracic vertebrae. We've got the ribs and the sternum, so all that kind of acts as the kind of protection around the lungs, and it must expand with the lungs. So there's that side of things. We've got the cervical spine, so the neck, and we've got the lower cervical spine where the nerves kind of exit from C3 to 5, and they head down there into the diaphragm, and they're the ones that kind of initiate the diaphragm to contract, to breathe through the respiratory centers in the brain. So already we have the cervical and the thoracic.
Just everything, just
Yeah,
this whole bit.
And then those slings that we mentioned earlier, they're heading into the kind of thoracolumbar junction to the lumbar spine. So there's quite a lot of connections through the spine and breathing. And it's been shown that patients with pain in those zones, so cervical, thoracic, lumbar, most definitely affects respiratory measures and volumes. So it just shows you how much that spine plays in breathing mechanics.
Going along with that, how does spine stiffness affect breathing? So if you're like kyphosis or scoliosis?
I think the most obvious one for that is that thoracic spine, that vertebrae and those ribs need to be able to mobilize. As those lungs expand, it needs to be able to mobilize. We mentioned about T7 to 10 previously and how they need to mobilize. So that's the common one. If that's stiff, it's going to restrict lung expansion. And then a knock-on effect from thoracic stiffness would be that lower cervical spine. You start becoming into this kind of protracted kind of cervical neck position because of your thoracic stiffness. And we know those nerves come from C3 to 5 down into the diaphragm, like I mentioned. And there's research out there saying with arthritis in the kind of lower cervical, it causes a delay in the kind of firing of the diaphragm. So it shows us that cervical stiffness or arthritis, thoracic spine stiffness can definitely affect mechanics and even the nerves firing the diaphragm.
Yeah, and I see that in the pulmonary functions lab, with my patients who have kyphosis or scoliosis, and they do show up as restrictive lung conditions, right? Because they can't expand, they can't mobilize.
And that's just the joints. You then got the muscle imbalances, and we mentioned how many muscles are involved earlier. So you get tightness and weakness and imbalances and spinal alignment problems, then most definitely you're going to start affecting respiratory performance.
When I'm in here with you and we do spinal manipulations, even with chiros and massage therapists, anytime they're trying to rotate me, loosen things, they ask me to take a big breath in and then a big breath out, and then they do that rotation. Can you expand and explain why you take this kind of approach?
I think mainly it's more a lot of the patients I see are a little bit anxious and a little bit worried about spinal manipulations and adjustments. So already they're kind of guarded and tight in the muscles. And then you've got your lumbar spine that's relatively large, and you've got these big muscles trying to protect that area, like the quadratus lumborum or those lumbar paraspinals. So you're kind of fighting against that kind of guard. So from my point of view, we know that an inspiration helps mobility and that eccentric mobility. So an inspiration allows me to kind of mobilize that body over, if we're talking about a lumbar spine. And then the expiration just helps you relax more as we adjust and manipulate that joint that we're after.
Like relax that guarding
Yeah.
kind of aspect.
Yeah. The neck, a lot of people are anxious about the neck. It's a little bit more easier to mobilize and adjust. But again, with these sternocleidomastoids, traps, scalenes, there's a lot of tension there. And it's just really uncomfortable for the patient if you're trying to adjust a neck that's doesn't want to be moved.
If they're holding their breath, probably that's really what they want to do when you're ready to turn their neck. They kind of hold their breath and you can't really turn it.
So I think the breath work is more about the relaxing side and relaxing that tension in the muscles to get the kind of benefits of an adjustment.
How does spinal manipulations positively affect breathing?
Well, in the clinic, we're kind of faced with the majority of the time rib restrictions or facet joint restrictions in the thoracic or the cervical or the lumbar spine. Tone of the muscle, so tightness around the thoracic spine and the neck again. And then we look to see kind of what a manipulation, a joint manipulation or an adjustment does. And we're kind of aiming for like a gap or a shear of the joint. And that kind of gives it a quick release, stretches the capsule, some may say, brings fluid to the joint, reduces pain through the nervous system, and it also releases tone of the muscles. So all those areas affecting breathing mechanics and causing dysfunction can be kind of treated by an adjustment or a manipulation of that structure that's stiff.
And even when you mention that relaxation, just even putting someone into that relaxed state will instantly calm down their breathing,
Definitely.
right? Because of the tension
Yeah.
that you've just now released.
Yeah. But it's quite amazing evidence-wise of how much after a manipulation, how much that muscle kind of
Relaxes.
relaxes compared to that structure that you've just
Do
adjusted.
you physically see or feel the patient kind of take that deep breath, like that big sigh, calm breath afterwards?
Definitely.
Because I
Definitely.
can kind of picture me doing that.
Yeah, it does differ. If a patient is very restricted and very tight and very sore, sometimes it can be a little bit of a shock for them and they can tighten up a little bit to protect.
Yes.
But then, but then it really does ease. But the majority of the time it's a quick release and the patient feels pretty amazing from it.
Can you share with us your top self mobility exercise for maintaining a healthy spine?
So this is a great one for that thoracic mobility. So you're going to come into a lunge position. And you can do it without support, but if you bring the ball onto the wall, you bring the knee to the ball, or you can use something a little bit bigger so you don't have to get so close, but it allows the pelvis to stay stable. So you can now focus on that thoracic mobility alone. Thinking about breathing as well here. So we can try two different options. You can breathe in to prepare and you can breathe out and you're going to mobilize this arm around towards me. Good. And back in.
And should my hand be against the wall?
That's nice. Keeping that spine aligned, rib angles again, breathing out, mobilizing. And maybe try the other way now. What about a breath in to mobilize? So you're going to breathe in as you mobilize that spine. See what one works better for you. And see if you notice any differences. Looks a little bit more restricted. How do you feel?
Yeah, I definitely like the exhale better with the movement. I feel like I can stretch a little further, and I feel like just a little bit less restricted.
Okay, so that's perfect for you and we would, continue that way.
In your strength and conditioning services, you mentioned that you assess body mechanics through strength, balance, mobility, and stability, which all these are affected by the way we breathe. Do you uh, uh, do you include breathing into your observations?
Definitely. I look at rib angles and I look at that pelvis and spinal position. And definitely think about breathing mechanics with these types of clients or patients. There's a quote from this top golf coach who sees all the top kind of golfers out there, and he the first thing he looks at is the grip. So even these golf pros who are so much years of training, the first thing he looks at is their grip position. So he takes it all the way back to make sure the foundations are there. So with a strength and conditioning patient, they might be doing higher level stuff, but we definitely take it back and make sure their foundation is correct with regards to their mechanics and ribs.
Alignment.
Yeah, alignment and all that, as you say, relates to breathing mechanics.
And how do the breathing patterns change based on the type of exercises they do? As in how, heavy they go, like if they do heavy weights to lightweight to stretching.
It's a tough area. I think lots of people have different opinions on this kind of subject. For me, if we're doing basic strength, hypertrophy exercises, if you want to call that 2 lots of 10, 3 lots of 10, whatever the guidelines are saying, then I would be taking into account what we've kind of gone through today. So that's the kind of inhalation on the eccentric part of the exercise. So if we're talking about a squat, that would be an inhalation on the way down. And the concentric part, so the rise up, would be the exhale. So that's the kind of way I would be going down that route. But it gets a little bit dicey when you're starting to bring in power exercises, high weight, 1 rep max kind of load. Gets a little bit potentially unstable if you're starting to bring in those breathing concepts. So in that sense, going back to what we were talking about at the initial stages, was to try and increase as much pressure and stability as possible. So for us, that would be that deep inspiratory breath to improve the intra-abdominal pressures, and then you can go through your lift. So in that sense, you're kind of holding the breath during the move to try and create as much stability as possible.
In the spine,
In the spine,
core,
yeah.
everything kind of.
So that's completely different to what we've been talking through the whole podcast, really. So people have different opinions on that, but that's kind of where I am at with regards to power and 1 rep max. We see a lot of CrossFitters here. So again, another area that's completely different, where a lot of them are lifting quite high loads. Endurance comes into it, a lot of fatigue in that sense, and they're also technical moves. So I think it becomes quite difficult then for some of them to come away and focus on breathing mechanics during those types of exercises. For those patients I see, we tend to do a lot of the breathing mechanics and postural improvements initially during the rehab stages. And then hopefully maybe muscle memory comes into it when they're in their classes and completing those kind of long duration, heavy lifting, functional moves. Hopefully there's some muscle memory there, and it kind of, they've got that stability. They can focus a little bit more on the technicality of the lifts, and hopefully they've got enough stability there.
I think where they can benefit from is kind of integrating that breathing pattern into their warm-ups, where the load is a little bit lighter, and then they can create that breathing pattern where it can just be kind of a thoughtless or mindless thing when they go into that more heavier load, higher intensity.
Yeah, I think that's definitely the aim. I think some of those clients, some of those patients, when fatigue sets in, they're definitely going to be using their accessory muscles more, and they fatigue quicker. So for those patients, maybe during their set, they need to be thinking and coming back to that kind of diaphragmatic breathing, for example, or just trying to release some kind of tension to take off their accessory dominance.
And there's nothing wrong with using those accessory muscles, because that's what they are for. That's why they're called accessory or secondary respiratory muscles, because they do kick in during fatigue, and they do help everything when you get into that kind of stage and range of your exercise. And in terms of stretching, what about stretching?
Stretching for me is the perfect time to just consider what we've completely just talked about. That's your perfect time to have good posture, spinal levels. You can focus on the breathing in that sense. Again, it differs for different people. So there's me saying to do a nice inspiratory hold or an inspiratory breath, sorry, during the mobility to try and improve flexibility. But some patients don't want to go down that route, and they will head into their breathing out during a mobility move, like a yoga kind of activity or pose. So yeah, but for me, stretching is the more kind of, that's the time where you can focus a little bit more on levels and spinal levels and breathing mechanics and take advantage.
And in terms of like the mechanics of breathing, so I think for me, when I'm like stretching, let's say, if I'm doing like a spinal rotation and I breathe in and then I'll breathe out, and then I'll kind of go and exhale and kind of move into that, and then kind of stay here. And then I'll take those couple of breaths to kind of, work maybe this area here because it's a little bit more open. And so when that expansion during that inhalation comes through here, it's kind of like I'm stretching more of this side, but that exhalation kind of gets me more further back and more into that rotation. Does that kind of...
That's a really good point. Like, I think we've just been talking about single plane kind of exercises and breathing where that's not functional and that's not realistic. So yeah, you're right. To go into those end ranges and focus on breathing in that sense is kind of perfect rehab wise.
If we're not breathing efficiently during a specific movement pattern, how can this affect our progress to rehabilitation?
Yeah, it's an interesting point because I see all the time accessory muscle usage, but in the wrong kind of time. So traps, for example, I'm always trying to work shoulder blades. Mid to low traps seem to be the area for me with regards to improving stability. And I suppose if the patient's using their traps to breathe and is tense up there, then it's not going to allow, it's just going to be a battle to then fire those mid to low traps. And it's a battle anyway, you know, patients aren't aware of those muscles back there. So again, if you're using the wrong muscles, then it's just going to affect rehab progress. You're just going to be fighting against muscles that are dominant already. Similar to kind of that thoracolumbar junction area that I'm always treating, where if you're not expanding into those lower lungs and keeping that pelvis neutral, and you're just loading into that zone, flaring out those ribs, again, you're battling against, firstly, what we've done during treatment to try and mobilize. And then whilst you're exercising at home, again, you're just increasing the dominance of those muscles that are kind of pulling the spine, affecting respiratory mechanics. So yeah, efficiency in breathing patterns is vital for rehab. So again, like kind of if we're using those, if we're loading into the thoracolumbar junction, we're contracting and shortening paraspinals, QLs, for example. And again, QLs are going to be the ones that are going to start affecting spinal alignment, and pelvis alignment tends to be the kind of culprit. So again, using that wrong patterning, we're going to start then affecting MSK issues like pelvis instabilities and restrictions. So an example of breathing inefficient with a lift, or like a shoulder press, for example, is, I suppose, again, loading that thoracolumbar junction. So if you're going into a lift and you're loading through, I'm sure a lot of people have been told to kind of drop in and get a little bit more stable. But I think the breathing side of things is going to help more with that, instead of just tucking in the pelvis, for example. Because if you're flaring out the ribs, if you can keep these ribs and these spinal kind of pelvis in position, yes, there's going to be some movement. But if you're thinking about these areas a little bit more and not allowing them to flare out, I think you'll be in a better position as you go into the lift. So you can breathe in, breathe out during that kind of concentric phase, thinking about the levels here more than what's happening at the back.
And that could create like injuries. Like it doesn't really look that
Definitely, yeah.
safe.
Most people lift through there because it's just you're a little bit weak or a little bit fatigued. You're going to go to the next level where you can kind of hinge. And that zone is where we see all the sprains. So yeah,
Okay.
rib angles, spinal levels,
Alignment.
yeah, is key.
Clinical Pilates, in my opinion, is a highly effective approach to rehabilitation. And one of the fundamental aspects of Pilates is breathing. Can you explain why Pilates emphasizes breathing with movement?
I think it starts, well, we're shown straight away about the pelvis position. And I keep talking about the pelvis position, but it's really important with regards to breathing, the pelvis position, and stability of the spine. So we're told to kind of center the spine. So find that neutral pelvis position. Rib angles, again, are very important, not flaring. So everything's neutral here. And then that kind of breath work, again, has been shown to kind of activate inner core. And there's just a big connection there with the right breathing pattern to kind of engage transabs, pelvic floor, and that's your inner core zone. So if we're talking about spinal stability, that's why it's important to be bringing in breath work with Pilates.
Okay.
It also kind of it also calms the patient. As soon as you put a patient onto the reformer, everything comes on. The posture's incorrect because they're not used to the move, fine, but they kind of tense up. And again, using all those muscles that we don't want to be used, really. So as soon as you start talking about or setting that spine and calming their breath work down and bringing in diaphragmatic breathing, again, we see just everything relaxes and they're able to focus a little bit more on the area that should be focusing on, so that inner core. Okay. It's a little bit like when you're trying to facilitate a muscle, for example, and that's proven where you can actually tap a muscle to activate because it's sending a message to the brain. Yeah, so it's a similar kind of process where you're focusing that mind on an area that we want to be engaged. So it kind of works there, kind of stops the other noise and the other areas being activated and tight, and allows them to focus on spinal stability, and inner core.
So we talked about like what types of breathing patterns we can use for strength and conditioning. Is clinical Pilates a different approach for breathing when we're doing movements?
It depends where you train, you could say. It depends on people's opinions. From my point of view, I I go with the approach of a breath to prepare for the exercise. So it kind of focuses them on the activity they're going to do. As I said, it calms tension throughout the body. So breath work initially. So a breath to prepare, and then an exhale during that concentric phase of the Pilates exercise. So slightly different to some of the areas that we've been focusing on breath work, but that's how I approach it. And I find patients, once they get that approach, it's just a lot more beneficial for them because they can target the areas they need to target instead of there being restrictions.
So let's say like if they're pushing away on the Pilates machine, is that breathing in or breathing out?
Yeah, for me, that would be a breath out. That's the kind of concentric phase.
Okay.
They've prepared themselves with a breath in, lower lungs, pelvis is set, breath out to
Push out.
push out, to load.
Okay. So what if I don't coordinate the way I breathe on the clinical Pilates machine? Would I notice the difference if I breathe opposite from what you suggest?
We see it all the time. I would focus on prompts initially to try and get you to kind of breathe the way we want to breathe. But again, if it's difficult and you don't like to go down that route, or you're just not getting it coordination wise, then that's fine. Sometimes I see if you change that breathing strategy, then we start seeing kind of upper abs becoming a bit more involved, or we start seeing gripping through the rib cage or the hip flexors. That's what I kind of tend to see if you change that breathing pattern. So I think for certain things, when the exercise is relatively simple, that's definitely an area we can try and promote the correct breathing. And then perhaps later, as the exercise gets a little bit more difficult, or there's a little bit more going on, we could see how that body responds the way you breathe. And if you notice the difference, maybe that's all you need to know, like that awareness again. And maybe you'll start to realize our way is possibly better with regards to mechanics and how your body feels. So it's definitely a learning process, and it's definitely not a one size fits all with you have to breathe like what we're saying.
If we do like a bird dog position and I breathe the opposite way, I feel like, my core would kind of collapse in a specific movement.
Yeah.
And I'm sure that you see that.
Yeah, I think that's what I mean by the gripping as well. So we would see a lot of the gripping through here, as you say, you collapse
Okay.
and you load in. Or again, those traps come on for us, and we're always trying to get rid of those traps
Okay.
in a
Because of the
way.
stability
Yeah,
not being there.
yeah,
So that's really kind of, I think, the major difference that someone would feel is that stability and being able to hold those positions
yeah.
for a certain amount of time.
Yeah, exactly. It's every day, the amount of patients I see every single day on the Pilates reformer machine, they all think it's a new concept that we're bringing in, but once they've done it and they've kind of got hold of that breathing pattern, they're amazed by actually how it feels and how they can get a little bit more isolation into like the inner core. And so yeah.
Yeah, I agree. Reformers Pilates classes are tough and it takes a lot of concentration for a single movement. If you can give us one advice to get the most benefit out of the clinical Pilates class, what would that be?
I think you've got to kind of stick with it initially. A lot of patients come in wanting kind of hard technical exercises, but from a clinical Pilates point of view, we're taking all that back a little bit. And again, just starting from the foundations. So once you get to the more exciting technical exercise, you'll be in a good position, and you'll be using the right muscles, and the breathing mechanics will be optimum, and you won't have to think about things as much. So to get to that point, we've got to kind of start a little bit more simple. So my advice would be to kind of stick with it initially, and to go home and practice that coordination of breathing. So if it is a struggle, and it is a struggle for a lot of patients, then go home, practice the coordination of breathing with a simple exercise. So level 1 Pilates that we would show you in the clinic, and just try and get that rhythm so you don't have to think about, the 10 different things that you require in a simple exercise in Pilates. So get the breathing right, get the foundation set, and then you'll progress a lot quicker without injury, and hopefully you should be receiving the benefits from clinical Pilates.
Thank you, James, for your expertise and your insights today for our listeners. It's been an amazing talk about physiotherapy, breathing, and wellness. And I can't believe how much we've kind of touched upon today. So that was great.
Well, thanks very much for inviting me. Yeah, looking back over it, it is amazing how much breath work comes into it, and breathing mechanics and injury prevention. So for me as well, it was just enlightening as well to just dive into the breathing mechanics really. So thanks very much.
The goal of this channel is to create awareness around respiratory wellness, and your participation is what gets us there. If you like this topic and would like to learn more about anything and everything about breathing, don't forget to subscribe, like, share, and hit that notification bell for our next episode. Until then, inspire to respire.